At Enable, we support our staff in a wide variety of ways. One of these is workplace supervision with a GP. The process of workplace supervision with a GP is an opportunity for the link worker to talk to the GP about how they are getting on in their practice specifically. So it can be things like cases they can talk about. They can talk about IT and admin, how they're getting on with their linking up to the GP system, their relationship with the GP practice staff, and also kind of getting involved in the team meetings and being part of the team. It's really important to have that point of contact with the GP to be able to be the sort of connector between the link worker and their practice.
I think it's impacted our PCN by having a greater understanding of the social prescribers and the needs they have and the issues they face. But I think also for the social prescribers, it's helped in terms of understanding and fitting in with the primary care team which they work. And often they're put in this situation where they may not have worked within primary care before. It's a different environment, has its different challenges. And us as GPs have had many years of experience and of training, which they won't have been involved with. But hopefully what we can do is we can link that together so they can sort of understand how best issues can be faced, but also in terms of being able to deal with the effects on their well-being and how actually that can affect them day to day and offloading on particularly challenging cases, for instance.
So I regularly attend sessions with the GP. I think that they have really helped me in developing my understanding of primary care and how it works. They often really help me to sort of address any medical questions that I have. They help me with any logistical issues I'm having in the PCN. And I think overall they just help me to feel reassured in working for the PCNs that I'm understanding the systems, understanding the boundaries of my role, what I can do and what maybe is not my job. Ultimately that benefits the patients because we know exactly what we're supposed to be helping them with and we know what other people can do. So I think that just overall sort of multidisciplinary effort is really helpful.
I would really encourage people to consider clinical supervision for the social prescribing link workers. I think it really enhances the service and it allows them to really feel supported, but also understanding as a two-way process. So we can look at how referrals can be improved, but also ensure that there's utilisation of the service as well. So we do find in some practices they may not use the social prescribers in terms of appropriate referrals, but also there may be underutilisation. So we can focus on particular practices or GPs to be thinking about how can we improve the service which is offered. There's been situations where the link workers have contacted me afterwards or even in the session and actually said, this is, it's been really useful. And there's been times in which link workers, it can be an emotional situation and actually you do think, is this is it effective? And actually is this time well spent? Because of course, primary care is so busy and it is very difficult to be able to justify time allocated for this supervision. But actually, I think it does make a more fulfilling role for both me and for the link workers and the entire of the PCN as well. And so there has been situations where afterwards they've approached me and said thank you, but also in the sessions themselves. And I think it's useful that having that feedback of going actually what's working well, what's not working well, but overall it's been really very positive.
I think it's quite scary to actually approach GPs to ask for supervision in the first place. But once you do, I think it really does help. It's just help with the general sort of better supporting patients to know what they're entitled to and who should be helping them with what. And I think overall it's just made me a more well-rounded link worker and knowing my role and my boundaries with that.